Did you know that the first African-American neurologist in the United States was Puerto Rican? Ana Judith Garcia was born in Puerto Rico around 1931, in a social context shaped by structural racism, economic segregation, and severe educational limitations for black women. Her life trajectory directly challenges the traditional narrative of who has been recognized as a pioneer in the history of medicine in the United States. The names, occupations, and economic status of her parents are not widely documented in official public sources such as medical biographies, university archives, or historical press records. This absence is not accidental, but rather a reflection of the systematic invisibilization of educated black families in Puerto Rico during the 20th century. Even so, indirect historical analysis allows us to reasonably conclude that she came from a functional and stable household, that literacy existed within her family, and that there was active and sustained support for her education, something extraordinary for the time. We know this because, without cultural capital, though not necessarily economic wealth, a professional and academic path like hers would have been virtually impossible. There is no evidence that she came from a landowning, industrial, or economically elite family. From an early age, she demonstrated exceptional intellectual abilities. She was identified early as an advanced student and completed educational stages at unusually young ages. She grew up under the U.S. educational system implemented in Puerto Rico after 1898, a deeply unequal and racialized system, but one that for the first time allowed formal access to public education for black girls, something that did not exist under Spanish colonial rule. This limited but real access created a crack in the system that she and her family knew how to take advantage of through discipline, effort, and academic excellence. Faced with persistent racial and gender barriers in the United States, especially in specialized medical education, she made a strategic and uncommon decision for a black woman of her time, to train in Europe. She studied medicine at the Université de Montpellier in France, where she graduated as a doctor of medicine in the mid-1950s. There, she earned high grades and stood out in an extremely demanding academic environment. France offered public universities, lower tuition costs, and less formal racial segregation than the United States during that period. Her European training was not an elitist privilege, but rather an alternative path of access in a world that systematically closed doors to highly qualified black women. Upon returning to Puerto Rico, she completed a residency in internal medicine and later a residency in neurology at the University of Puerto Rico. In doing so, she became the first woman neurologist in the history of Puerto Rico and the United States, and one of the first black women specialists in neurology. At a time when neurology was still a relatively new specialty, her presence represented a structural shift in medical practice. She later received advanced training in electroencephalography at Massachusetts General Hospital, affiliated with Harvard University, fully integrating into the academic and clinical networks of the U.S. medical system. In 1966, she founded and directed the first electroencephalography laboratory at the Puerto Rico Medical Center, a position she held until 1995. This laboratory made possible, for the first time on the island, the systematic diagnosis of epilepsy, the clinical evaluation of seizure disorders, the specialized study of brain lesions, and the medical management of neurodegenerative diseases. More than making isolated discoveries, Dr. Garcia institutionalized modern diagnostic neurology in Puerto Rico, an achievement of enormous structural impact that transformed clinical practice and raised standards of neurological care. For decades, she served as a professor of neurology at the University of Puerto Rico Medical Sciences campus. She was known for extreme academic rigor, strict clinical discipline, and demanding ethical standards. She trained neurologists, internists, and general practitioners who later held key positions both on the island and abroad. Her influence is measured in entire generations of health professionals, not in the number of academic articles published. Her commitment extended beyond hospitals and universities. She was a co-founder of the Puerto Rican Epilepsy Society and the Puerto Rican Parkinson's Society, through which she promoted research, education, public awareness, and direct support for patients and families. These efforts helped reduce stigma around neurological conditions and expanded access to specialized medical care, particularly among historically marginalized communities. Inducted into the Puerto Rican Medicine Hall of Fame, her legacy extends far beyond the island. Her work contributed to the development of more equitable health practices in Latin America and inspired generations of Afro-Latina women in medicine, science, and STEM fields. She overcame deeply rooted racial and gender barriers and defended education as a tool of empowerment, summed up in her motto, "You are worth what you have in your head." Although history has insufficiently documented Afro-Puerto Rican women in medicine due to systemic underrepresentation, Dr. Ana Judith Garcia stands out for her direct, structural, and lasting impact on neurology, medical education, and public health. If you made it this far, follow us to learn more stories of Afro-Puerto Rican figures who changed the history of Puerto Rico.